when you live in a rural area, you're more likely to die of a car accident because of the geography. If you live in this rural area, you are likely to be on the lower socioeconomic scale. You therefore have some health habits like smoking, alcohol intake, or higher propensity for mental illness. And so as a healthcare provider, we had some significant challenges both in accessing care, including transportation, including access to particular services like mental health, substance abuse, primary care. And so it was a different landscape out here than it was in other places.
We were very keen to really engage with our partners to not only identify most impactful solutions, but also prioritize them. From my perspective as leaders in that community, of course, I would entrust that next steps with the Hope and Wellness Project in their very capable hands.
The reason why this has been so successful in Hope in the Fraser Canyon is because the trust, the relationships, and the partnerships were pre-existing to the funding. When the health authority decided to give the funds to the community, they were able to work together to develop successful, sustainable solutions to local challenges.
The magic of this initiative has been the collaboration and relationship building, the local customization that we've been able to provide.
We know what the issues are. It's the right starting point. We know what the issues are.
Yeah.
So don't tell us what the issues are. We know what the issues are.
And it's actually been quite brave of the health authority to allow us to have this freedom to create the programs as identified by community needs. I think initially they were shocked when the community came back and said that our number one issues are transportation and food security. And you know, it's not normally what people think of in healthcare, but this is huge in a rural community.
Before this funding was available, there was an unfortunate tragedy where a young man had passed away on the highway. Because of this funding, we were given the opportunity to get the District of Hope to have transit service up the number 7 corridor. And with a micro health grant, we're able to then put 3 bus stops in our First Nations community. This gives everyone in that community the ability to stay safe, but also to build partnership with the District of Hope, the Health Authority, and our local community.
Transportation has been significantly improved as a result of this project, and really under 3 separate areas. One is we empowered the District of Hope to bring public transport to Hope. We also empowered a local agency, Hope Care Transit, who had an existing volunteer driving program. We've empowered them to expand the services they provide. And the third way we address transportation is through our health services coordinator, because she actually brings health specialists now to Hope so that community members don't have to go to Chiliwak or Abbotsford to get that service.
So this initiative has benefited residents by connecting them to other healthcare services, including doctors and nurse practitioners, substance use services, including opiate agonist treatment, take-home naloxone training and kits, harm reduction supplies, mental health and homelessness services. It's also benefited by youth-specific programming, including the MindFit program, the Learn to Eat program, and an annual youth summit.
So when I think about Hope receiving the Rural BC Community Award of 2019, I'm just so proud of the partners, the relationships and the trust that made this possible. Without them, we wouldn't be able to do the good work that we do in community and the Canyon, and we're really seeing a huge benefit. So thank you to every single person who made this possible.
For me, the big takeaway would be how the different partners work together and the collaboration for the community, and to seeing the actual results in the community from that collaboration between the healthcare stakeholders and seeing that, as I said, seeing the results. That's the big thing.
I think the biggest impact that's been made because of the funding is the opportunity for relationships to be built in the community with our community partners. Organizations like Care Transit that provides transportation, or HATS that provides youth and mental health outreach, or even Read Right that provides volunteer organizations. Those organizations, those groups, and those people matter, and the difference that they make matters into the lives of the community in Hope.